Hello, everyone. We're going to be talking a little bit about patient movement. This is something that we all know how to do very well, but we're going to do a quick refresher on it. And I hope you guys have a little fun with the presentation I worked up for you. So we're going to talk about how to move patients without making your back extinct. So about 46% of firefighters have experienced some kind of pain or strain on the fire ground before. Over half of these injuries have happened outside of the fire ground itself. So misconceptions out there stating that for those who train first responders and how everything works, they believe that there's a lot of myths behind how we do things. As firefighters, we think we know everything, which we know we don't, but we believe sometimes speed is the answer. We believe that we should always be lifting with your legs, and that apparently being physically active is just enough to get by. So we're going to talk about it real quick that speed is not the answer. We need to slow down because when we slow down, we're able to break down the task more manageable and get it done the proper way instead of rushing through it. When it comes with lifting with your legs. So most firefighters think they're lifting with their legs, but because of the sedentary lifestyle, they developed a sitting problem that causes muscular imbalance that is make it hard for you to fire for glutes. It's no well-known secret in the fire service that we do a lot of sitting, but we still are very active. But for those who don't go out and train themselves or just be active and are aware of themselves that you can actually hurt yourself in the long run. One way to solve it is to get up and exercise, be active. So they think being physically active is enough. Well, not really. Over time, if you reach down and forward, you're just putting a great load on your back that you can't get rid of. Even if you feel like you are strong, over years, the pressure does add up. So not only does being physically active and fit help, but we have to start looking at using some lifting devices or other ways to assist to actually improve the outcome. So this is some fun fact that I found, and actually a little more research on it, but apparently lifting more than 51 pounds from the floor can lead to injuries. I know this doesn't make sense because everything we do on the fire ground or day-to-day work, we're lifting way more than that. It comes down to techniques, as we know, and not everything can be done with technique. So to sum up the bottom part with the not so fun fact, to sum that up as you can read it, basically picking up roughly 51 pounds from the floor is equivalent to almost 800 pounds of a compressive load on our spine. I don't know how the equation formula works to do that, but these are studies that they're coming out with. But we do know about working with up to 800 pounds on the spine of an untrained individual, you're going to get hurt down the long run. And we know very well that no patient we pick up is 51 pounds. So imagine this multiple times a day on our shift, and that can be added up to almost 2,000 pounds of a compressive load that we're putting on our spine. Again, if you can figure out the exact formula for that, please feel free to share it. So a little bit about prevention, how to prevent ourselves. We have mobility and flexibility. Most of us know what both are. To sum it up, mobility is be able to actually lift your leg to place your foot on top of a 24-inch bumper without using hands. And then flexibility is just being able to lie on your back, passively pull your knee to your chest with both hands and hold the stretch. Both are very well needed in this job. So we're going to ask the question that we all know too. What can I do to help myself from getting hurt? Well, very simple. Nothing new to anybody. We're going to stop lifting from the floor. Good luck on that. Try to use handles for lateral transfers, bed sheet draws when we go from the cot to the ER bed. Work together and just slow down. So again, how do we lift someone from the floor, bed, chair, etc.? We all know this. Utilize our lifts on site that are able. For us out here at Five, we go a lot of nursing home runs and we do a lot of lifting. They even have lifts on site, the Hoyers. They have mega movers for our assistance. We try to utilize anything we can. Everybody has done this before. When it comes to this, you try to get a stable stance, get your feet planted, embrace your core, just tighten everything up. and try to keep your back straight. We need to know that we need to lift as a crew. Definitely avoid any sudden jerks or twists. And of course, if we do feel pain at any point, we should stop and ask, do we need more resources or how can we do this better? So get down and dirty. So not all lifts are the standard. We all know that. We all know that most people aren't going to be sitting there in the front porch waiting for us and just need to sit back up. We'll stand back up. No, we're getting the people that are stuck between the toilet and the wall. We're getting people stuck between the bed and the dresser. And think about this, they claim your average person is 136 pounds. No, the average person we're going to is 250 plus. So when we put all this perspective, we got to be really careful about what we do. We know our core is needed for strength, and we know that we need proper form. So when it comes to this, we can't always do proper form, and every single lift is going to be completely different. You're not going to be able to get in the proper stance to do a proper deadlift on a patient when he's pinned against a wall, who's 300 pounds, and you might be reaching over, bending at your back. We know. I don't need to sit here and preach about this anymore. It's be careful with how you lift, as we know. Don't do anything extra that may hurt you. And if you can move the objects out of the way, move the object out of the way. Or if you can drag the patient to a better area, drag the patient. But just realize we got to be smart, try to embrace your core, try to use good form as you can, and work as a team. So again, how can I improve myself to accomplish this? You keep hearing this over and over from people on the fitness committee. It's no brainer. Deadlifts, cleans, and overall core strength overall do improve the health of you and will actually improve the benefit of everything that you do in your life. Deadlifting and cleans are great movements, to full body exercise that will tighten your core, your lower back, your posterior chain. These are excellent when it comes to patient assisting them off the floor. So these are big things that myself and a lot of other people work on to just better ourselves. So we're going to sum it up of this informational training is we need to slow down. You got to work together. Use lifting devices, whatever you can, sheets, mega movers. If you have the resources, use them. And we try to do our best to have a proper form when we're lifting. Having core strength overall, it works great, and we got to make sure we're just exercising. So, at any point you're thinking, how could I improve something that I need to get done? Well, reach out to us. We're here for you. Don't be afraid to ask us. That's why we're here. So reach out to anyone on the committee. If you're not sure who it is, well, I'm one of them. So reach out to us any way you want, and we can try to help things out and get you guys the goals you need. Thank you. Hopefully you enjoyed it, and be safe.